Good afternoon, ladies and gentlemen. Let me present to you my PhD topic, which is the role of knee injuries in the development of osteoarthritis. My name is Miklós Máté. I'm a fourth-year resident at Uzsoki Street Hospital in the Department of Orthopedics and Traumatology. My vision is to bring along and also to develop our center, which is already well known for its cartilage care and repairment. And my mission is to have decision-making for daily practice and to have a more clear picture about post-traumatic osteoarthritis. Here you can see I have two ongoing projects, which both of these projects we are investigating post-traumatic osteoarthritis after anterior cruciate ligament injuries. In my first project, we investigated osteoarthritis after ACL injuries, and we compared two interventions. Anterior cruciate ligament injuries is one of the most common sporting injuries. In the US, there is 130,000 ACL reconstructions yearly. The superiority of surgical treatment compared to non-operative is low based on the recent studies, and although it is frequently cited as ACL rupture is an indication for reconstruction, but the progression of articular cartilage degenerative change is controversial. Our aim was to analyze short-term osteoarthritic evolutions in these two interventions. Our clinical question was quite simple. Does surgical treatment decrease the incidence of post-traumatic osteoarthritis? The patients were the ones with ACL rupture, and the two interventions were surgical and conservative treatment. Our hypothesis was that there is no difference between surgical and conservative treatment on developing post-traumatic osteoarthritis. We made a systematic search with more than 2,000 articles we found. We had 13 eligible articles. Some words about the knee osteoarthritis outcome score. It is a patient-reported questionnaire which assesses knee osteoarthritis in 5 different scales. 0 indicates the worst case, and 100 indicates the best scenario for the patient. In our meta-analysis, we went through in 2 RCTs with these 5 different scales. We haven't found a significant difference only in quality of life, as you can see, which favors surgical treatment. In the other 4 scales, we haven't found any significant differences. The other thing what we made is that we went through 5 different MRI grades on the same studies, and we had 2 interesting findings there. First of all, we haven't found any difference in surgical and conservative treatment. And second one, and it is more important, that most of the structural changes appear to, most of the structural changes clearly visible after 3 months compared to the 5 years. Excuse me for that. Our study strengths are that this is the most comprehensive study in this topic. It could serve as a recommendation for study designs and guidelines in the future. The limitations was that we only have 5 RCTs, 2 RCTs, and with 5 different comparable outcomes. Also, there wasn't any comparable radiological outcome, and it is the limitation for the study that we have a high variety of grading systems. To conclude, in young active adult patients with an acute ACL tear, we can say that the strategy of ACL reconstruction doesn't provide better patient-reported outcomes at 2 years. The implication for practice is that we should consider conservative treatment. Also, we have to highlight for the patient that the risk of future knee lesions and osteoarthritis remain relevant even after ACL reconstruction. And implication for research is we would advise that to have more randomized trials, use standardized assessment tools, and also to have standardized protocols and populations. Now we are at the phase just before the language editing part, and we would like to publish it for an impact factor of 30 in the British Journal of Sports Medicine. Based on our meta-analysis and our first project, we have a clinical trial where we are investigating these early onset osteoarthritic changes with MRI. We are comparing isolated ACL injured knees with a healthy index knee. Isolated ACL injury is 80% of the demonstrated 80% with MRI. The outcome in the prevalence of osteoarthritis is highly variable. And also, as we concluded in the meta-analysis, early osteoarthritic changes could seen by MRI. Here you can see our PICO. The clinical question is that does ACL reconstruction decrease the development of osteoarthritis? And also we are looking forward to make a tunnel positioning study. The patients are the ones with isolated ACL rupture, and two interventions will be the injured knee, and we are comparing it with the contralateral healthy one. And the outcome is to see what are these early osteoarthritic changes. The clinical implication is to understand what I was talking about before, these early osteoarthritic changes. We made a protocol, you can see here in the table, and we are going to look for the outcomes, first of all, investigating by MRI, especially with bone marrow lesion, proteoglycan depletion, and bone bruising. And also we are making clinical and patient-reported questionnaires like the iSeries one. So as an overview, here you can see my two projects. The one has already finished, and the second one is still ongoing. We have 3 patients now, and we are getting more and more. And to conclude, I also give you the Confucius quote: "It doesn't matter how slow you go, as long as you do not stop." Thank you for your attention.
I ask you, Miki, based on your results, what is your suggestion as an additional therapy of hyaluronic acid or viscosupplementation in this patient group? I mean, patient group treated conservatively, or?
Yeah, first of all, thank you for the question. Our real goal is to choose those patients who are at high risk of osteoarthritis. So those patients, we can see MRI changes early after the reconstruction. I would highly recommend hyaluronic acid and viscosupplementation. This is one of our main reasons why we are doing it, to highlight those patients who are at high risk of osteoarthritis. So So after the treatment, not only surgical but conservative treatment, it would highly recommend it if we could follow up the cartilage deterioration. So I would highly recommend it.
In the operated group?
Well,
because you said the same percentage of the osteoarthritis appear or rarely.
Yeah, sure. It would be considerable and also recommended.
Thank you.
Thank you. Congratulations, Mickey. Actually, I'm just wondering whether this question is as easy as you stated, that actually you are comparing the conservative to the surgical methods. Like, of course, regarding the conservative method, we can have a lot of questions. Whether this was a study from Germany, or I believe that it's not the same as in Ukraine right now. Yeah. They won't achieve the same results, or even between the methods, like which muscle to strengthen then, or is this really so, one or the other?
You mean, yes, there's a big diversity of treatment, not only in surgical but conservative also. Sorry, I didn't understood exactly the question. That
yes, this actually, how heterogeneous are these interventions?
It's really heterogeneous, and the second project is what we are making to get a homogeneous patient group, and also to have the same operating method. Like we are operating these patients with the same technique. Also, the rehabilitation program is at our hospital, at our department, with the same rehabilitative protocol. So, so yes, it's a methodological bias that in a lot of places there are different methods and different rehabilitation program. And in my second project, we are trying to have a clear picture what is the truth in our population. Of course, it will be not going to be a 1,000 and 5,000 patient analysis, or hopefully in the years maybe yes. But we try to have an answer in our protocol and in our surgical method. That wonder there, is it a problem with especially with the tunnel positioning, with the graft type? We will have an answer if we compared and if we get these results after.
Thank you very much for your answer. Actually, this way it will be very hard to have a proper international guideline, because there will be plenty of studies with plenty of methods. But thank you very much.